Greetings, class. So for today, my topic is ICD-10. For this class, I'll be covering topics like what is an ICD-10, types of medical coding classification, examples of ICD-10, and advantages and disadvantages of ICD-10. What is an ICD-10? So ICD-10, it is the 10th revision of the International Statistical Classification of Disease and Related Health Problems. So ICD-10, it contains codes for diseases, signs, symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or diseases. So it was first created in the year 1983. It became endorsed by the 43rd World Health Assembly in 1990, and it was first used by member states in 1994. It was then replaced by ICD-11 on Jan 1, 2022. Like its predecessor, ICD-9, ICD-10 is based on the International Classification of Diseases, which is published by the World Health Organization. So there are two common medical coding classification systems, which is the International Classification of Diseases, which is called the ICD, and the next one is Current Procedural Terminology, that's called the CPT. So ICD, International Classification of Diseases, it serves as a broad range of uses globally and provides critical knowledge on the extent, causes, and consequences of human diseases and death worldwide. So how it is done is through the data that is reported and coded with the ICD. And the next one is the CPT. It's called the Current Procedural Terminology. It is a set of codes, descriptions, and guidelines. It is intended to describe procedures and services performed by physicians and other healthcare providers. Each procedure or service is identified with a 5-digit code. So this is an example of ICD-10. So ICD-10 is a 7-character alphanumeric code. So each code begins with a letter, and that letter is followed by 2 numbers. The first 3 characters of ICD-10 are the category. So the category describes the general type of injury or disease, and the category is followed by a decimal point, and then it's followed by subcategory. Coming to the advantages of ICD-10, one of the biggest benefits of ICD-10 is how it will emphasize accuracy and fraud detection. The second is it reduces the chances of medical coding errors. So the terminology, it is standardized, and the new codes also contain less ambiguity, thereby reducing the odds of errors happening during the building process. Third point is improved patient safety. So patient safety will also be improved by making it easier to identify those in need of disease management. So ICD-10 also makes it easier to share information on drug side effects, which results in less opportunity for error. And also it provides more precise and detailed diagnosis. So the current ICD-9 system contains almost 17,000 codes, while ICD-10 has almost 160,000 codes. In fact, one of the primary reasons for implementing ICD-10 is because it allows for the very specific use of codes, providing those medical professionals the opportunity to give more detailed information. Coming to the disadvantages of ICD-10, the very first point is loss of productivity. So in countries where ICD-10 has already been implemented, there was a sizable reduction in productivity, which results in the loss of hundreds of thousands of dollars as staff got used to the new system, and as a result it results in slowing the processing. The second point is denial of benefits resulting from inaccurate coding. So even if one digit in a code is transposed, it leads to a different diagnosis than what the patient really has. So if it happens something like that, the patient may be denied life or additional health insurance because of the condition or diseases they don't actually have. One of the other disadvantage is the new certification criteria. So current medical coders will need to retake certification exams within their professional organizations. So the seminars and classes they are being asked to attend are costly, and the exam itself is costly. So these are the references. I hope you all enjoyed my class. Thank you.